Hi, everyone. Welcome to another one of our video chats here today. I am joined today by Dr. Mark Anderson, infectious disease specialist with CHI Memorial, who's going to kind of walk us through what he's seeing sort of on the front lines as we fight this virus, and also through some recommendations of what people can do to keep themselves safe. Welcome, Dr. Anderson.
Thank you. Thank you, Jeremy. I appreciate y'all having me in this forum. So as far as what's going on now, just in our numbers have been quite low, certainly until recently in our community, and that could have been one of two reasons. One is we really didn't have much of it here, or number two, it was here and we weren't seeing it because we weren't doing much testing. Testing was a real problem here, access to it, and that was greatly improved through development of a lab here. Dr. Forrester at the Baylor School, that's been an amazing benefit. I usually don't miss an opportunity to praise her and praise all the people that helped make that lab happen, because that enabled us to do a lot more testing where we could get, less than 24-hour turnaround. We actually are able to do some testing in-house now at our hospitals and other hospitals as well. But we've begun to get more access to testing in general everywhere, and we've also begun to do more testing of most of likely cases, and so that I think does explain the increased numbers that all of you are seeing now in Chattanooga. It's in the newspaper, on TV every day, and so I think we're testing people in industry, essential industry that has not shut down, in which people are at close quarters. There's certain factors in places like meat processing plants. They're very loud and people have to shout at each other, and that actually singing and shouting actually enhances spread between people, and in particular if they're asymptomatic and don't know they have it. But they have to, if they have to shout just to be, for communication. And then also testing households. This virus likes clustering, and so probably a lot of testing that was going on earlier in the community when it just generally wasn't available, or people who had more access to it, able to get around, go to a testing center, were more established in a medical practice, they could get an order. So probably more people who lived in smaller households, 1 to 4 people households. But as we've tested households in some of our community here where there's multi-generation household, or more people in one house makes it easier to spread. We found more there as well. So I think some of our increase does reflect that. But there's also not just the positive cases, but how many sick people do you have who are sick enough to be in the hospital or in an ICU? And that's the reason we don't think we had very many cases earlier in Chattanooga. You can not know about your asymptomatic cases, which is a large number of people with this virus, but you will know about the people sick enough to be in the hospital. They're there. And those numbers stayed pretty low, and they're still not high, but they've gone up just in the last week a little bit. It's too early to say that means too much. Obviously, people are wondering, is that because we've opened up more? I don't think so, but I may give you a different answer tomorrow. I say that about everything that I say with this virus over the last few months, as we really have everyone, including the most informed, have continued to learn every week. Could it, are we starting to see now results of more people out and about for Memorial Day weekend? I think that's a real possibility. Incubation period 4 to 7 days. We're 7 days from last Friday, Saturday. That could be happening too. Still too early to tell. So we're really monitoring that closely. here at Memorial, we had kind of shrunk down our COVID unit to just one place because we had so few cases. We've gotten a few more this week. So now particularly with the weekend coming on, we've extended back up to get ready for more people just in case. So that's kind of what's going on in the community now.
Let me ask you about capacity since you brought it up there. How well equipped are we to deal with a spike at this point?
I think we've got a lot of capacity right now. I mean, we're only using a fraction of our capacity in any of our hospitals. And I think we have a lot of capacity. If we started seeing the sort of infection rates seen in northern Italy or New York and Brooklyn, New York City or Manhattan, Brooklyn all of New York City the last, a couple of months ago, that would stress our system. I think that's unlikely. So right now, I think we have the capacity for regular beds as well as ICU beds in our community.
Okay. And you mentioned, the recent increase, and we can't read too much into it yet. But we have seen, as people start to go back out into the community, that a lot of this depends on how people behave as we start to open back
Exactly.
up, right?
Absolutely.
So what should people be doing right now as they start to go back out?
Right. That does need to be done carefully. Without question, the virus is still here, all over, not just in Chattanooga. So people that are traveling as well are going to encounter it in other communities. One sort of downside of the fact we probably were a low prevalence community, that means we have a lot of susceptible people in our community. So we have a potential for a big outbreak here if people just totally abandon precautions. I don't see that happening on a large scale yet. A lot of the reopening that's happened in local businesses I think has been done well. There have been some I've been able to actually see and walk through. Did that along with our CEO at Volkswagen a couple of weeks ago. Did a walkthrough with the senior managers and everyone at the aquarium a week ago. And just I've talked to people at other businesses, surveyed what we're doing in our own offices here with all of our people. So there's a lot of good preparation going on, and I think that things that have reopened, they've for the most part done well. What people need, but people still need the personal responsibility. I think getting large numbers of people in close quarters is just not good now, even with masks. So it makes me a little anxious in Georgia, for example, that bars and nightclubs are opening back up. I want to see them open, but enjoy a nice drink as well as anyone else. But I think getting people in close quarters is probably not quite safe yet. We're not there yet. So avoiding that, things that have put us in close quarters before, going to meetings, church, for example, that can be done, but people need to be spaced out, and I think they need to be in masks when they're inside. Masks they're a real game changer in this. I think that's made the difference in things being able to open back up safely. For example, our hospitals and clinics. We learned over the 2 months here at Memorial, I think, how to keep people safe in an environment where we actually have definite COVID-19 patients, but also everywhere there's possibility possibility of unknown COVID-19 patients because of asymptomatic people, because of people being contagious for a couple of days probably before they become symptomatic when they do. We had cases that came in here after we implemented our mask program who had it and we didn't know it. They came in with like a gastrointestinal bleed, chest pain, something else. It became evident they had the virus by their symptoms after they were already here. In spite of that happening on a number of occasions, we didn't have any spread here at the hospital. So we've employed those same strategies in our clinics, and by following that carefully, we can keep people safe, both the people that work here and as well as the people who come to us for care. And so I think you've got to do that. As I've told people, I think a lot of us have made fun of places in Asia where everybody puts a mask on with sort of every illness that comes along, and we're not laughing anymore. Hong Kong, for example, they started doing universal mask right off the bat, and they've had very little COVID there. So, and it's important to emphasize, because it's not always, people don't always necessarily understand this, but if I was in the small room with one of you and I had the infection and didn't know it, you're wearing a mask is a big protection to you, unless I just cough right in your face. What's an even probably better protection for you is if I'm wearing a mask. So we want to encourage people, when you go out there and wear a mask, it's not that you're not, people are going to accuse you of being, being paranoid or overreacting. I've heard it all like that. But in fact, what you're doing is being very polite and considerate of all of your fellow Chattanoogans when you do that. If you're in a small place up next to people where they can't get away from you, and you're not wearing a mask, you are being, in these days, utterly an inconsiderate person, doesn't care about their fellow man. That's probably not the way to start the conversation off. You want to emphasize the positive first, obviously. To get more people to wear it, we do have to do that. We have to encourage people to use the positives. I think in America,
sure.
make people do anything, it's not going to work.
Absolutely. And I do want to emphasize for folks, our Q&A is open. So if you have questions for Dr. Anderson, please go ahead and type them in there. And I will ask them to him. But I do want to talk a little bit about sort of the overall timetable that we're looking at here.
Right.
We often talk about getting back to some sort of new normal. That's because this won't really be over until there is a vaccine, correct?
Yeah, there's a couple of things that could make this easier for us to get back to normal. One is a truly effective vaccine, with a highly efficacious vaccine that we can mass produce. That's going to take a while. Even if we have some like stunning breakthroughs, we're probably talking at least a year. And there is the distinct possibility we won't ever have one because we don't have any human vaccines against coronaviruses yet. There are other diseases, for example, HIV, in which we've never been able to develop an adequate vaccine. So it is not a given. But there are animal vaccines for these viruses, so that holds out some hope. It's not going to be fast, though. Second thing is truly effective treatment, so that when people do get sick with it, we can arrest that process. And we got some candidates. There's things we're already using on our patients here. Unfortunately, they're not game changers. The drug remdesivir, convalescent serum, I think they have a positive effect. Remdesivir is a little further along in information from trials, but it's a modest effect, and definitely what we've experienced here is it's been just modest. We just don't have enough information yet on convalescent serum, although we have it available here thanks to Blood Assurance. They were very much on top of that to make that available to our community.
Okay. Um, back to masks for a second. We've all seen a lot of different conflicting information at different times about masks. Your point is
Right.
taken that one of the best things we can do at this point is for all of us to wear them. Um, what sort of protection do they offer, and do the different materials that they're made out of make a difference?
Yeah, that does make a difference. I mean, when if you're the infected person, just about any mask will make a difference. The best are the commercially manufactured that's the paper mask, sort of loop mask, are very effective, both for both sides of the equation. If someone's infected and he's around other people. Early on, of course, we told people don't wear those. Yeah, stay away from those. We need to preserve all of them for the medical personnel. And then one of many times we've changed our recommendations, and there will be more, but as we learn more. But so those are good. Those are in better supply now. Cloth mask, it needs to be, probably just a regular old cotton handkerchief. It's not enough. It needs to be, there have been guidelines issued for that, and there are people that are making these, even locally, sort of following those guidelines. It usually is going to be several layers, and it needs to be something that will kind of stay up next to your face, that's not going to droop. So sort of buying one from somebody who knows what they're doing, either buying it from, a vendor or someone locally who kind of knows what they're doing if they're making them, because there are people making these things in their homes. It's probably better than that, rather than something you just kind of make yourself. And I've seen the gamut of that, from the bandanas to the cutoff shorts. The best one I saw was the cutoff shorts that had the zipper on the front, and the second photo showed the guy drinking a long neck beer with the zipper down. But anyway, So, if you don't have anything else, sort of putting something together yourself until you can get a more reliable product is still okay. That still helps protect you against protect you from spreading it to others.
Sure. And you sort of covered this already, but we did have a question. It's the data. There's not enough data, and it's a little too early at this point to tell whether or not the rise in hospitalizations has anything to do with our reopening efforts. Correct?
That's correct. That's correct. We're certainly worried about that possibility now. And as I said, I think also on a big traditional holiday weekend, it's been a wonderful occasion for doing group activities in our country for all of our lives. That coming along, even without the reopening, I think people would have been out and about and mixing with each other more. So I think that's going to have an effect outside of the reopening.
So another thing we've seen a lot of conflicting information on at this point is just sort of what we're seeing symptomatically when people get this virus. It seems like new possible things crop up from time to time. At first we thought, young people were, very, very low risk. And now we see information that some of them are getting symptoms that are different at times. Can you just sort of give us an overview of what you're seeing as far as how this virus is affecting people?
That's a good question, and it illustrates yet another difficult thing about this virus that's caused it to spread so much. I mean, before I address that, just the fact you can spread it when you're asymptomatic, even if you develop symptoms a couple of days before that. That didn't happen with the first SARS virus, and that made it a lot easier to really isolate that one and put a stop to it. We're not going to be able to put a stop to this one because it's spread, and it's also very infectious. The other thing that has made it difficult is just we call the just protean clinical manifestations of this. A lot of, and this happens with many diseases. When you get into millions of cases, you begin to see, variants, unusual manifestations, what have you. But this actually has different presentations commonly. So the first, we thought it's cough, it's fever, shortness of breath, and we really thought in the early data from China that almost everybody had a fever, but it's not that at all. Probably less than half of people who actually get sick have a fever. Cough and shortness of breath are common, but many people don't have that. They present just with flu-like symptoms. This malaise, just feeling bad, achy all over. Some people present with only gastrointestinal symptoms. Gastrointestinal symptoms are common in those who present with the classic stuff, the respiratory stuff. But some people only get the nausea, upset stomach, and diarrhea, and that's their only manifestation. There's rashes, skin findings, chilblains, and sometimes that shows up first without anything else. It's more common in the serious manifestations and illness, need for hospitalization. Without question, they're more common in older people. They really begin to go up. Your percentages begin to go up at around 60 on up into the 90s. But young people can still get very, very deathly sick with this. I mean, that's one of the reasons I feel the lockdown and precautions were so important. People were saying, oh, well, people die from influenza every year. It's just older people, just people in nursing homes. And well, some of those people probably would have lived a number of years more, but it's definitely not. There are a lot of young and older healthy people with years of life left that this virus has taken out, thousands of them. We've seen that here, and that's so. Then, of course, children still don't seem to get very sick with this, but even the kids can get this very serious sort of systemic inflammatory disorder that looks like something called Kawasaki's disease, and it's rare, but you get a lot of people infected, like in New York, and you get a significant number of cases. So, but yeah, the clinical variation of the presentation of this infection is wide. It can be baffling, and that also has compromised our ability to sort of track it and contain it.
Okay. Well, and along with that, you mentioned we've drastically increased our testing capabilities at this point.
Right.
So if you have anything that you suspect could possibly be coronavirus, would you recommend that folks go get tested at this point?
Yes.
Okay.
Yeah, particularly if you're in a job where you're gonna, or just in a household where you're gonna expose other people, you should have a very low threshold for getting tested. You should have a very low threshold for not going to work, particularly if you're around vulnerable people.
Okay, so get tested if you're sick and think there's any possibility there at all. Wear a mask, maintain social distancing. Anything else we should be doing to stay safe right now?
Well, I think just trying to think of things from a business perspective. Doing the things to help people maintain their distancing. With lines, tape on your floors or carpets, so people know what's a safe distance to stay apart. It was interesting at Volkswagen, they had created stanchions with ropes, to sort of channel people through to get them all into work quickly, but it's keeping them apart. So what they did to help them know how far apart to stay, they put the stanchions 6 feet apart to hold the rope. So creative stuff like that to let people know that they're keeping safe distance. I've seen that in stores, grocery stores, et cetera. So I think, giving people some help and knowing how far to stay apart. And also businesses, if you, I think the alcohol hand gel is more available now. We're making it in our community. I know Chattanooga Whiskey has been making it. That's what they were
Yes.
at Volkswagen. So, making that freely available so that people, again, somebody who's sick, if they touch their face and then particularly if they touch your hand, that's a big thing. That's how colds and this virus, other respiratory viruses, get transmitted quite frequently is hand contact. And sick person's blown their nose, the unsick person then reaches up to scratch their nose or blow their nose. I mean, everybody's nose itches and runs in this region. And it's probably not as big a deal as we worried as far as surfaces go. But, if you touch a surface that somebody else who's infected has just touched, you could potentially, get a transmissible virus on your hand and then touch your face. So having plenty of hand hygiene material out there for people in a business, I think would also be important. As it says, should be more available now.
Okay. Thank you so much for being here, Dr. Anderson. Is there anything else you want to leave us with before we wrap things up?
No, I think we've kind of talked about the important points, safety points. So, yep, I think we've covered it pretty well.
Okay, we appreciate everything you and the other healthcare professionals out there are doing. You guys really are on the front lines, and you're going to be our best defense if we do see another spike around here at some point. And so we really appreciate you taking some time out of your day to come here and answer some of our questions.
For sure. Thank you.
Thank you so much.
All right. We'll see y'all.